Hello health champions, today we are going to talk about the top 10 healing herbs you must have for everyday wellness, special precautions, and warnings. Let's jump right in. Welcome back. We hope you enjoyed that captivating introduction. There are times when it might be smarter to use an herbal remedy than a pharmaceutical. For example, sometimes an herb offers a safer alternative. I believe it's better to use mild remedies for minor health problems and save the more potent and risky prescription medications for more serious conditions. Here then are my top 10 favorite healing herbs, their uses, special precautions, and warnings. All are safe and effective, but be sure to discuss any herbs you are taking with your doctor. Some herbal remedies such as antidepressants can interact with medications. 1. Calendula. Calendula helps to treat several skin problems, and is also a good remedy for fevers and chronic infections. Calendula has been used to relieve inflammation of the mouth, throat, and stomach, popular as a topical cream or ointment to relieve rashes and irritation and to help heal wounds. It's also used as an antiseptic. Preparation and doses. Tea. Pour 1 cup boiling water over 2 teaspoons petals. Steep for 10 minutes. Strain. Use as needed as a mouthwash, gargle, or tea. Ointment. Apply to skin 2 or 3 times per day as needed. Special precautions and warnings. Pregnancy. Don't take calendula by mouth if you are pregnant. Calendula may cause an allergic reaction in people who are sensitive to the Asteraceae compositae family. Members of this family include ragweed, chrysanthemums, marigolds, daisies, and many others. If you have allergies, be sure to check with your healthcare provider before taking calendula. 2. Ginseng. Ginseng helps relieve and prevent mental and physical fatigue. Shown to reduce the frequency and severity of colds. Possibly beneficial for erectile dysfunction. Preparation and doses. Tea. Simmer 1 teaspoon dried and sliced root in 1 cup water for 10 minutes. Strain. Drink 1 to 2 cups per day. Standardized extract, 4 to 7% ginsenosides. 100 to 400 milligrams per day. Concerns. Purchase from a reputable manufacturer, as ginseng has often been adulterated in the past. Special precautions and warnings. When taken by mouth, ginseng is likely safe when used short-term. Doses of 100 to 3,000 milligrams daily have been used safely for up to 12 weeks. Side effects might include headache, but it's usually well tolerated. Insomnia. Taking high doses of ginseng might cause sleeping problems. If you have trouble sleeping, use ginseng with caution. Schizophrenia, a mental disorder. Taking high doses of American ginseng might cause sleep problems and agitation in people with schizophrenia. Surgery. Ginseng might affect blood sugar levels and might interfere with blood sugar control during and after surgery. Stop taking ginseng at least 2 weeks before a scheduled surgery. 3. Hibiscus. Hibiscus tea originates from North America and Southeast Asia. It's tart and has a cranberry-like flavor. If you believe that only high-end coffee shops can make this tea, you are mistaken. You can brew an equally delicious cup of this beverage at home. Uses. lowers blood pressure and has mild diuretic activity, traditionally used to ease sore throats and colds. Preparation and doses. Tea. Pour 1 cup boiling water over 1 to 2 teaspoons dried flowers. Strain and sweeten, if desired. Drink 2 cups per day. Capsules. Take 1000 milligrams 2 times per day. Concerns. Talk to your healthcare provider if you have high blood pressure. Special precautions and warnings. Hibiscus is commonly consumed in foods. It is possibly safe when used in medicinal amounts. Hibiscus tea has been used safely in amounts of up to 720 milliliters daily for up to 6 weeks. Side effects are uncommon but might include stomach upset, gas, and constipation. Pregnancy. Hibiscus is possibly unsafe to use during pregnancy. It might stimulate a menstrual cycle or have effects that might terminate pregnancy. Breastfeeding. Hibiscus is possibly unsafe to use while breastfeeding. It might have effects that can be harmful to the infant. Children. Hibiscus is possibly safe when used at a dose of 2 grams by mouth 3 times daily for up to 4 weeks in adolescents 12 to 18 years of age. There isn't enough reliable information to know if it is safe for children under 12 years old. Surgery. Hibiscus might affect blood sugar levels, making blood sugar control difficult during and after surgery. Stop using hibiscus at least 2 weeks before a scheduled surgery. 4. Ginger. Ginger has been used for centuries for its medicinal properties and is commonly used to treat nausea, inflammation, and digestive issues. Ginger tea is a popular way to consume ginger, and can be made using fresh or dried ginger. Uses. Ginger tea can be made using either fresh or dried ginger. Dried ginger can be a convenient option for making ginger tea, and can be stored for longer periods of time than fresh ginger. Whether you use fresh or dried ginger, ginger tea can be a delicious and healthy way to enjoy the many benefits of ginger. Preparation and doses. 1. Start by boiling water in a pot or kettle. The amount of water you use will depend on how much tea you want to make. 2. While the water is boiling, prepare the dried ginger. You can use either whole dried ginger root or ground ginger. If using whole ginger root, peel and slice it into thin pieces. If using ground ginger, use 1 to 2 teaspoons per cup of tea. 3. Once the water has boiled, remove it from the heat and let it cool for a few minutes. This will help to prevent the ginger from losing its flavor. 4. Add the dried ginger to the water and let it steep for 5 to 10 minutes. The longer you steep the ginger, the stronger the flavor will be. 5. Strain the ginger tea into a cup and add honey or lemon if desired. Ginger tea can be enjoyed hot or cold. Special precautions and warnings. Children. Do not give ginger to children under 2. Children over the 2nd of May take ginger to treat nausea, stomach cramping, and headaches. Ask your doctor to find the right dose. Adult. In general, do not take more than 4 g of ginger per day, including food sources. Pregnant women should not take more than 1 g per day. For nausea, gas, or indigestion, Some studies have used 1 g of ginger daily, in divided doses. Ask your doctor to help you find the right dose for you. For pregnancy-induced vomiting, some studies have used 650 mg to 1 g per day. Do not take ginger without talking to your doctor first. For arthritis pain, one study used 250 mg, 4 times daily. Taking ginger in high doses, it may cause mild heartburn, diarrhea, and irritation of the mouth. You may be able to avoid some of the mild stomach side effects, such as belching, heartburn, or stomach upset, by taking ginger supplements in capsules or taking ginger with meals. People with gallstones should talk to their doctors before taking ginger. Be sure to tell your doctor if you are taking ginger before having surgery or being placed under anesthesia. Pregnant or breastfeeding women, people with heart conditions, and people with diabetes should not take ginger without talking to their doctors. Do not take ginger if you have a bleeding disorder or if you are taking blood-thinning medications, including aspirin. 5. Lemon balm. Lemon balm is known as Melissa officinalis, a member of the mint family, is considered a calming herb. It was used as far back as the Middle Ages to reduce stress and anxiety, promote sleep, improve appetite, and ease pain and discomfort from indigestion, including gas and bloating, as well as colic. Lemon balm, Melissa officinalis, is a plant that is sometimes used in its dried form, or by extracting its oil, as an antibacterial, antiviral, and antioxidative agent. It is also approved by Commission E as a treatment for nervousness and insomnia, and it is commonly used in folk medicine to treat anxiety, gastric complaints, especially associated with stress, hysteria, melancholia, nervous palpitations, migraine, headaches, and high blood pressure. Uses: gentle calmative, eases tension, digestive upset, and colic, topical creams used for fever blisters. Preparation and doses. Tea. Pour 1 cup boiling water over 5 or 6 fresh or 1 teaspoon dried leaves. Steep for 5 minutes. Strain and sweeten, if desired. Drink several times per day. Concerns: none, suitable for all ages. Special precautions and warnings. When applied to the skin, lemon balm is possibly safe for most adults. It may cause skin irritation. Children. Lemon balm is possibly safe when taken by mouth by children for about 1 month. Thyroid disease. Lemon balm may change thyroid function, reduce thyroid hormone levels, and interfere with thyroid hormone replacement therapy. Avoid lemon balm if you have thyroid disease. 6. Licorice. Licorice, also known as licorice or Glycyrrhiza glabra, is a popular herb and flavoring agent used in various culinary and medicinal applications. It has a distinctive sweet flavor, and its root has been used for thousands of years in traditional medicine. Uses: licorice is a traditional Chinese medicine, and Ayurveda have long used licorice for its potential health benefits. Licorice root has been used to treat various ailments, including digestive issues, sore throats, and coughs. It may have anti-inflammatory, antioxidant, and immune-boosting properties. Preparation and doses. Tea. Simmer 1 teaspoon dried and sliced root in 1 cup water for 10 minutes. Strain. Drink 2 or 3 times per day for up to 7 days. Capsules. Take up to 3,000 milligrams per day for 7 days. Do not exceed 500 milligrams per day if taking for longer than 7 days. Concerns. Do not use high doses for longer than 1 week as it elevates blood pressure and causes potassium loss. Deglycyrrhizinated licorice, a special preparation commonly used for heartburn, is safe for prolonged use. Special precautions and warnings. When taken by mouth, licorice is likely safe for most people when eaten in typical food amounts. Licorice that contains glycyrrhizin is possibly unsafe when consumed in large amounts or for a long time. Eating large amounts of licorice can cause severe side effects including heart attack. People who have heart disease, kidney disease, or high blood pressure are more sensitive to it. Heart conditions. Licorice can cause the body to store water, and this can make heart failure worse. Licorice can also increase the risk of irregular heartbeat. Don't consume licorice if you have a heart condition. High blood pressure. Licorice can raise blood pressure. Don't consume large amounts of licorice if you have high blood pressure. A muscle condition caused by nerve problems, hypotonia. Hypotonia is a medical term that refers to increased muscle tone or muscle stiffness. It is the opposite of hypertonia, which is reduced muscle tone. Hypotonia can be caused by various factors and conditions, including neurological disorders, injuries, and certain medical conditions. Licorice can lower potassium levels in the blood. This can make hypotonia worse. Avoid licorice if you have hypotonia. Kidney disease. Consuming large amounts of licorice could make kidney disease worse. Hormonal effects. Licorice can affect hormonal balance, especially in women. It may lead to changes in estrogen levels and menstrual irregularities. Pregnant or breastfeeding women should avoid licorice in large amounts. Allergic reactions. Some individuals may be allergic to licorice. If you experience symptoms like hives, itching, or swelling after consuming licorice, discontinue use and seek medical attention. Pre-existing conditions. If you have pre-existing medical conditions, such as diabetes, liver disease, or kidney problems, it's important to consult with a healthcare provider before incorporating licorice into your diet or using it for medicinal purposes. Sexual problems. Consuming large amounts of licorice can lower interest in sex. It can also worsen erectile dysfunction by lowering levels of testosterone. Always consult with a healthcare professional or herbalist before using licorice for medicinal purposes or if you have concerns about its potential risks and benefits. Additionally, make sure to follow recommended dosages and usage guidelines provided on product labels. 7. Milk thistle. Milk thistle is a flowering herb that has been used for centuries for its potential medicinal properties, particularly in the context of liver health. Uses. Protects the liver from damage caused by environmental toxins, medications, and alcohol. Recent studies suggest it protects the kidneys similarly. Preparation and doses. Extract, guaranteed minimum of 70% silymarin. Take 400 to 700 milligrams per day in divided doses. Special precautions and warnings. Milk thistle extract is likely safe for most people when taken by mouth. In some people, taking milk thistle extract can cause diarrhea, nausea, intestinal gas, fullness, loss of appetite, and possibly headache. When applied to the skin. Milk thistle extract is possibly safe when applied directly to the skin for short periods of time. Allergic cross-reactivity. If you have allergies to plants in the Asteraceae composite family, such as ragweed, marigolds, or daisies, you may be more likely to experience an allergic reaction to milk thistle. Gastrointestinal disturbances. In some cases, milk thistle supplements can cause mild gastrointestinal disturbances, such as diarrhea, bloating, or an upset stomach. Reducing the dosage or taking it with food may help alleviate these symptoms. Dosage. It's essential to follow recommended dosage guidelines when using milk thistle supplements. Taking excessive doses may lead to side effects or adverse reactions. The appropriate dosage can vary based on the specific product and individual factors, so consult a healthcare provider for guidance. Quality and purity. Ensure that you are using a reputable and high-quality milk thistle product. The purity and quality of supplements can vary, and it's essential to choose a reliable source to minimize potential risks. It's crucial to consult with a healthcare professional before using milk thistle or any herbal supplement, especially if you have underlying medical conditions or are taking medications. They can provide personalized guidance and help you determine whether milk thistle is suitable for your specific situation. 8. Mullein. Mullein is a biennial plant known for its distinctive appearance and a history of use in traditional herbal medicine. It is native to Europe and Asia but has become naturalized in many parts of North America. Uses. Leaves commonly used to relieve cough, sore throat, and chest congestion. Steeped in oil, the flowers relieve earache. Mullein oil or ointments may be applied topically to soothe skin conditions, such as rashes, burns, and insect bites, due to its potential anti-inflammatory properties. Joint pain. Mullein has been used traditionally to alleviate joint pain and inflammation, though scientific evidence is limited. Constipation. Mullein has been used traditionally as a mild laxative to relieve constipation. It's important to note that while mullein has a history of use in traditional medicine, scientific research on its efficacy and safety is still limited. Preparation and doses. Tea. Pour 1 cup boiling water over 1 to 2 teaspoons leaves. Steep for 10 minutes. Strain, sweeten, and drink as desired. Special precautions and warnings. Allergic reactions. Some individuals may be allergic to mullein. If you are sensitive to other plants in the Scrofulariaceae family, such as figwort, foxglove, or snapdragon, you may also be at risk of an allergic reaction to mullein. It's advisable to perform a patch test before using mullein products extensively. Skin sensitivity. Handling mullein plants or products may cause skin irritation in some people. Use gloves when handling the plant to avoid skin reactions. Pregnancy and breastfeeding. Limited research is available on the safety of mullein during pregnancy and breastfeeding. It's best to avoid mullein during these periods unless directed by a healthcare provider. Children. While mullein is generally considered safe for most adults, there is limited information on its safety for children. Consult with a healthcare provider before giving mullein products to children. Avoid contaminated sources. When using mullein, it's important to ensure that you are using a clean and uncontaminated source. Harvest or purchase mullein from reputable sources to avoid potential contamination with pesticides or other harmful substances. Diabetes. Mullein may have blood sugar lowering effects. If you are taking medications for diabetes, monitor your blood sugar levels closely and consult with your healthcare provider to adjust your medication if needed. Gastrointestinal disturbances. In some cases, mullein preparations can cause mild gastrointestinal disturbances, such as diarrhea or an upset stomach. If you experience such symptoms, reduce the dosage or discontinue use. Pre-existing medical conditions. If you have certain medical conditions, particularly those related to the respiratory system, it's important to consult with a healthcare professional before using mullein. They can provide guidance on whether mullein is appropriate for your specific situation. Surgery. Mullein might have an impact on blood clotting, so it's advisable to stop using mullein at least 2 weeks before scheduled surgery to minimize the risk of excessive bleeding. 9. Garlic. Garlic is a pungent and strongly flavored herb and vegetable that is commonly used in cooking for its distinct taste and aroma. It belongs to the allium family, which also includes onions, leeks, and shallots. Garlic is characterized by its bulbous shape, which is composed of multiple individual cloves encased in a papery white or pinkish skin. Uses: potent antimicrobial, often used to combat colds, ease sinus congestion, and stave off travelers' diarrhea. Studies show that regular use can help gently lower blood pressure. Preparation and doses. Eat 1 to 2 cloves fresh daily. Capsules: take 4 to 8 mg allicin per day. Enteric-coated products may be superior if specifically treating diarrhea. Concerns: may interact with warfarin. Special precautions and warnings. When taken by mouth, garlic is likely safe for most people. Garlic causes side effects such as bad breath, heartburn, gas, and diarrhea. These side effects are often worse with raw garlic. Garlic might also increase the risk of bleeding and cause allergic reactions in some people. Bleeding disorder. Garlic, especially fresh garlic, might increase the risk of bleeding. Diabetes. Garlic may have hypoglycemic effects, potentially lowering blood sugar levels. Individuals with diabetes should monitor their blood sugar levels carefully when using garlic supplements and consult with a healthcare provider for guidance. Pregnancy and breastfeeding. The safety of garlic supplements during pregnancy and breastfeeding is not well established. It's advisable for pregnant and breastfeeding women to consult with a healthcare provider before using garlic supplements. Gastrointestinal discomfort. Garlic may cause digestive discomfort in some individuals. Common side effects include heartburn, indigestion, and flatulence. These symptoms are usually mild and temporary. Allergic reactions. Some individuals may be allergic to garlic. Allergic reactions can range from mild skin rashes to more severe symptoms like difficulty breathing and swelling. If you suspect an allergy to garlic, discontinue use and seek medical attention. Drug interactions. Garlic may interact with certain medications, including anticoagulants, antihypertensive drugs, and certain HIV medications. If you are taking medications, especially those with narrow therapeutic windows, consult with a healthcare provider before using garlic supplements. Foul odor. The consumption of garlic, especially in large amounts, can lead to strong and persistent garlic odor on the breath and skin. This may be bothersome to some individuals. Surgery. Garlic may affect blood clotting, so it is advisable to stop using garlic supplements or consuming large amounts of garlic at least 2 weeks before scheduled surgery. This precaution helps minimize the risk of increased bleeding during and after the procedure. If you want to know more about garlic, you can check it out in my existing video. 10. Slippery elm is a tree native to North America and has been used for centuries for its medicinal properties and other practical applications. The inner bark of the slippery elm tree is the part most commonly used for its therapeutic benefits. Uses: people use slippery elm for sore throat, constipation, stomach ulcers, skin disorders, and many other conditions, but there is no good scientific evidence to support these uses. Preparation and doses. Lozenges. Take as directed. Tea. Pour 1 cup boiling water over 1 to 2 teaspoons powdered bark. Steep for 5 minutes. Drink 2 or 3 times per day. Concerns: take other drugs 1 hour before or several hours after consuming, as it could slow absorption of oral medications. Special precautions and warnings. When taken by mouth, slippery elm is possibly safe for most people. When applied to the skin, there isn't enough reliable information to know if slippery elm is safe when applied to the skin. In some people, slippery elm can cause allergic reactions and skin irritation when applied to the skin. Allergies. Individuals who are allergic to elm tree pollen may also be allergic to slippery elm. Allergic reactions can include itching, swelling, rash, and difficulty breathing. If you are allergic to other members of the Ulmaceae family, it's advisable to avoid slippery elm. Pregnancy and breastfeeding. There is insufficient reliable information about the safety of using slippery elm during pregnancy and breastfeeding. It's recommended to consult with a healthcare professional before using it in these situations. Medication interactions. Slippery elm may slow down the absorption of certain medications if taken simultaneously. It's advisable to take slippery elm at least 1 hour after other medications to avoid potential interactions. Gastrointestinal obstruction. Due to its mucilage content, slippery elm may swell and become gel-like when mixed with water. This property could theoretically cause gastrointestinal obstruction if taken without enough fluid. Ensure adequate water intake when consuming slippery elm preparations. Medical conditions. Individuals with certain medical conditions, such as diabetes or digestive disorders, should use slippery elm with caution. It may affect blood sugar levels or interact with medications used to treat these conditions. Consult with a healthcare professional before using slippery elm in such cases. Surgery. If you are scheduled for surgery, it's advisable to inform your healthcare provider about your use of slippery elm. It could potentially affect blood sugar levels and may interact with medications used during surgery. Thanks for watching this video, and be sure to subscribe to our channel for more informative content. Stay healthy and take care.